Morning and welcome to the new edition of Dr. Lamba's Awakening Call. We have been besieged by coronavirus and looking at the fatalities, one does feel that there has been an outcome of fear rather than the reality. I do not deny that millions of people dying has an impact. I do not deny that the people who have lost their dear and near ones are those who have suffered pain and disease, need to be sympathized with. But the reality is that the disease has killed far less people than other epidemics do. As I said once, that tuberculosis kills more than 5,000 people an hour around the world. The earlier pandemics killed much more than this pandemic has killed. But there's one thing which does worry me, and I was happy to learn that this worry of mine is shared by many across the globe. And that is the reality which the governments, the medical profession, and the community leaders are ignoring the reality of pandemic fatigue. You get tired of reading about, listening, talking about something which is not welcome. Pandemic has created such an aura of fear and misery with the attendant lockdowns, work from home, mask wearing, social distance maintaining, that one feels that if one is no longer a human being, the human beings have been converted into frogs in a pond, and that too not a nice pond, but a pond full of filth. The governments on both sides, east and west, ramp up restrictions on movement, restrictions on moving out, restrictions on work, restrictions on getting education. And the fear created by the resurgence of the COVID cases, the first wave, the second wave, and the third wave. Now, public health, public as a whole, average human being, is tired of that. The pandemic fatigue is becoming real. It is sapping the energy of the people around the globe. It's making people morose, dejected, despondent. As a matter of fact, nobody can deny that the healthcare and the frontline workers, as well as the families, are struggling to respond to the, and they responded heroically to the first wave, and they're trying to do it to the second wave. But if you look at the Gallup polls, they would show an increase in the number of people who say that they wear masks in the public, and the proportion of those avoiding gatherings with the families and the friends is diminishing. People are straining at their leashes. They feel tied up. So, like, a dog, when its leash tries to strain against a leash so that it can be free, that same thing is happening to the people. You can see that more and more people try not to wear a mask until forced to do so. You can see that the public gatherings are gaining momentum, especially in these protests, whether it's a Black Lives Matter or Antifa or any demonstration. Where is all that talk of social distancing and mask and the restrictions and the cleaning of the hands. Nobody even thinks of that. It is real, the fatigue. You know, there is a fog of fear, and the people then say, okay, we are going to die, we'll die. But as long as we are not dead, let's be alive. They might also quote Shakespeare and say, cowards die many times before their death. So, what we need is to be human beings. We have a need to be with other human beings. And this separation, social distancing, working from home, makes people fatigued. The frontline workers are tired. Let's not deny the doctors, the nurses, the paramedical staff. Since January, rather actually in November, but in this part of the world since March, they have been working almost around the clock. And the different countries, different provinces have different approaches to this epidemic. It's really tough for some businesses to open up at partial capacity to stay afloat. So they are closing down. And the anger and the fatigue is just not the ridiculousness of the extreme of pandemic and all that it has disrupted. It is hard for the people, especially for the small businessmen, to think. The concern of the risk of the family members and the family gatherings. And that human touch which is lacking is problem. From the corridors of the Washington or New Delhi or Islamabad or Ottawa onto the cobblestones of the streets. The coronavirus is roaring back. Let's not deny it. It is. And the authorities are ramping up the restrictions again. But this time around, they are forgetting that the people are not going to accept the restrictions quietly. There's a momentum building up. And I'm really amazed that the government, with all its intelligence agencies, has not been able to gauge the response of the people sullen, uncooperative, withdrawing, and these withdrawal symptoms are symptoms of mental fatigue. Even the hospital staff, as I said, they are demoralized after 7 months of virus fighting triage. And the people are not moved by the wartime rhetoric that the world leaders used in the beginning. The support that the public gave to the political leaders is gone when Modi called for the people coming out on the balconies, bang pots, light candles. People joined enthusiastically. If he was to do the same thing today, the response would at the most be tepid. And then the family members who willingly sealed themselves to his and they sealed themselves to protect themselves and the family members. And now they find it hard to resist the urge to reunite. They want to come back to the real life. So unless the governments are willing to enforce some sort of a martial law, force and backed restrictions, people may not accept lockdowns the way they have been accepting it. That will not do. And this is might be possible in some countries where people accept the authorities' dictates. But in European Union and in USA and Canada, where the people use logic and reason, the restrictions on business, on day-to-day life would not be taken kindly to it. And that's why you see the market is taking hit. The lack of discipline, which now we are seeing, will disrupt the recovery. And that's the biggest thing. The fatigue is making people lethargic mentally. Today, they are becoming mental wrecks. So, the economic recovery of 2021 is now in danger. Now, the majority of the health professionals and the forecasters saying that the coronavirus is likely to continue till 2022. That means 2 years of imprisonment, 2 years of solitary confinement, 2 years of the domestic violence increase, 2 years of the children being cooped up, 2 years of the people working from home, and the difference between working from home and working at home gradually disappearing. And then now the winter is coming. The fall has been grim, and this winter is likely to increase exponentially the pandemic fatigue. The weariness on wearing masks, staying away from others, only grows as cold weather forces people indoor all the more. So this one is nature pushing, the other is the government pushing. And can you believe it? Even the medical doctors, Canada's top doctor, Teresa Tan, she has said we have got to take care. There's a need to be more realistic. And these warnings have been broadcast by the prominent health authorities. As a matter of fact, as Tam said, and she told her Canadians, young Canadians particularly, don't give in to COVID-19 fatigue. The point is, you don't give in to fatigue, you suffer from it. So it's very easy to give advice, advice which goes against the grain of being a human being. It's very difficult to accept advice. No, I've always wondered, this duck and cover generation. This is ducking yourself, covering yourself. Because human beings normally go out, face the situation as it is. And then, if they suffer, they suffer. But this ducking and cover operation, the guerrilla warfare, the generation that has hidden nuclear bombs under this wooden school does, it's just like that. Bomb is going to fall, so if you hide under a table, you will escape it. No, you would not. If pandemic assumes more virulent form and the fatalities increase, ducking under the table is not going to save people. And the fact that nobody knows when this is going to end. They said that it will end by the end of summer, it will end by fall, it will end in the early 2021, and now they're saying it would not end before 2022. So this uncertainty is making people feel more dejected and despondent. And the pandemic fatigue. Now, this is a disease, and as a matter of fact, the health professionals need to work on this more than they work on the pandemic itself. Because pandemic fatigue is now becoming a pandemic. And the effect of the pandemic fatigue is mental, so the mental health problems, is social, the violence and the withdrawal, depression, and cultural, along with the political authoritarianism will increase and everything. So I think there's a limit to the number of the days that human beings can maintain panic. Then they say, okay, if you're going to die, let's die, but let's die as human beings. And when that state comes, then the mental and the physical revolt would be difficult to be controlled. I have come across some people who washed their hands so much and they sterilized everything in the homes. And the result was still those people felt sick. The point is that caution needs to be there. I do not deny it. But erring on the wrong side can have disaster effects. Where has gone the sharing of food and the laughing at the times of Thanksgiving or Diwali? Where has gone the joy of Eid and getting Eidi by the youngsters? Even the Christmas this year seems to be bleak. So the laughter, the joy, the exuberance of life has given way to despondency, stress, depression, withdrawal, and so on. We are at we are staring actually at the abyss, just at the cusp of abyss. One short step, and it would be a calamity, not only a disaster. I fear that. I hope the community leaders, the political leaders, the health professionals wake up to this issue and take remedial measures today, lest it may be too late. Pandemic fatigue is real, is disastrous. We need to counter it before it becomes a pandemic. Thank you.